Hi, my name is Brooke France, and my senior capstone project is a program recommendation for athletic trainers and therapists, which analyzes the five-factor model of personality and its relationship to adherence of sports rehabilitation. Traditional sports rehabilitation programs focus solely on the physical aspect of injury, and their main goal is to alleviate pain and get the athlete back in proper physical condition. This limited approach neglects the athlete's psychological side of the recovery process, which can be detrimental because when an athlete suffers from injury, their behavior and emotions play a major role in how they adhere to rehabilitation. This could influence their duration of recovery and future of re injury. There is a growth in research which addresses the emotional response to injury, which provides an adequate evaluation of all aspects of the injury. The biopsychosocial model and cognitive appraisals model of injury both aim for a holistic approach which gives more insight to each person individually. The biopsychosocial model of injury is composed of seven dimensions which are linked together. The characteristics of injury, such as the type and severity, location and history of any previous injuries, and the sociodemographic factors, which include age, gender, race, and ethnicity, along with socioeconomic status, have an influence on biological, psychological, and social factors. These three dimensions portray the intermediate biopsychosocial outcomes, such as the physical components of rehab and the rate of recovery. This moves into the overall sport injury outcomes, which are the desired quality of life, the athlete's ability to perform, and the satisfaction of treatment, and their readiness to return to competition. The cognitive appraisal model of injury is influenced by personal factors like injury type and individual differences, meaning age, gender, and personality, and the other influence is the situation in which that individual is in. This could be the sport or the position played, along with the pressure or support from coaches, family, friends, and peers. Together, the personal and situational factors determine the coping behavior, beliefs, and attributes of the individual. The circle of cognitive appraisal, emotional response, and behavioral response actively influence the recovery outcomes of both the physical and psychological sides of the athlete. While these models are very informative and portray the interconnections of biological, social, and psychological components, there was a recent study which evaluated athletic trainers and their ability to address patients' emotional and behavioral responses to injury, and found that most therapists lack the confidence to use any psychological treatments to improve feelings of stress, anxiety, anger, loss of motivation, and this is simply due to the absence of adequate training in sports psychology, therefore resulting in a lack of adherence to rehabilitation. Personality has a huge impact in injury and it is not properly examined during the recovery process. The definition of personality is the psychological qualities that contribute to an individual's enduring and distinctive patterns of feeling, thinking, and behaving. This means that personality determines individual behavior and the way that they think and cope with situations. Personality can predict athletic success because of its connection to coping and behavior. Therefore, it is extremely important during the recovery process. Ultimately, it influences the way people communicate and comprehend, which goes directly into an athlete's ability to adhere to training and rehab. The purpose of this program is to suggest the importance of personality and its influence on adherence to rehabilitation programs. There are five factors which makes up someone's personality: extroversion, neuroticism, conscientiousness, agreeableness, and openness to experience. Each of these domains includes six subdomains. Extroversion traits include friendliness, gregariousness, assertiveness, activity level, excitement seeking, and cheerfulness. The subdomains of neuroticism are levels of anxiety, anger, depression, self consciousness, immoderation, and vulnerability. Agreeable Agreeableness domains are trust, morality, altruism, cooperation, modesty, and sympathy. The components of conscientiousness are self efficacy, orderliness, dutifulness, achievement striving, self-discipline, and consciousness. Lastly, openness to experience is described by imagination, artistic interest, emotionality, adventurousness, intellect, and liberalism. The International Personality Item Pool, or the IPIP-NEO, is an assessment which estimates a person's level of each of the broad personality domains and their subdomains. This test classifies the individual as low, average, or high for each subdomain to contribute to the personality trait based on percentile estimates from the individual score in the lowest 30%, middle 40%, or highest 30% of averages that are supported from people of the same sex and age. It is important to note that low or high scores do not mean good nor bad, and it is also important because low and high scores are more accurate rather than someone who scored average in a trait. The suggested program will have athletes take the IPIP-NEO assessment, which is 300 questions, typically about 30 to 45 minutes, and they will share their results with their trainer or therapist so that they can formulate a plan and rehabilitate the patient more effectively and be more confident in their psychological techniques. If this were to be implemented, it would be beneficial to conduct a study which would consist of two randomized groups of athletes suffering from the same physical injury. Each group would perform a pretest, which is a self-assessment about their pain on a scale of 1 to 10, their levels of stress, their coping strategies, and their readiness to return to sport. One group will follow traditional rehabilitation procedures, and the other group will take the IPIP-NEO assessment. After the completion of that test, the trainers will change the delivery of treatment based on the personality traits of the individual for an increase in adherence. Following treatment for both groups, another self-assessment will be conducted which focuses on the athlete's readiness to return to sport, their satisfaction with treatment, and their level of confidence in physical and mental ability. These self-assessments will be used to measure and analyze the effects of implementation and personality type in the recovery process. Those who score high in extroversion are individuals who are typically outgoing, social, energetic, optimistic, and action-oriented. They best respond to changes in exercises and variation in routine, which will limit the loss of interest, which increases the level of intention and focus, and they should be approached with much enthusiasm and energy and should be placed in a fast-paced environment. Because these individuals are highly motivated and often overconfident, which is a good thing, but on the other hand, it can pose as a potential risk if not careful. These individuals are eager and driven to return to their sport, so they might try to do too much too fast. So, as a trainer, there must be precautions taken to prevent future injuries along with current prolonged injury. Introverts generally avoid superficial interactions and prefer working alone. As a trainer, it would be beneficial to engage in more meaningful discussion and avoid pushing them in unwanted social interactions. To ensure adherence to the training, decrease unnecessary social interactions to avoid increasing levels of stress. People with high agreeableness are preferred because they are very trusting and would do anything advised of them. The main concern here is that they may end up compromising with themselves about their pain levels in order to please those around them. As a therapist, it would be best to mindfully ask them about their pain or discomfort levels when performing challenging exercises. Those low in agreeableness are often skeptical, so explanations with each activity and asking athletes questions about what they think of the exercises, including likes and dislikes, would be optimal for finding the best exercises for them to perform. Conscientiousness concerns the way that individuals control, regulate, and direct their impulses. Highly conscious people avoid stress by purposefully planning and organizing their day. These individuals are reliable and hardworking. Goal planning would be beneficial for those that are like this because they appreciate organization and time commitments. The issue with high conscientiousness people is that most of them are perfectionists and they find it difficult when things are out of their control, such as injuries. Encourage them that mistakes are good and a sign of learning, and try to limit their stress levels and, and pressure that they inflict on themselves. Athletes low in conscientiousness tend to make more impulsive decisions and are very spontaneous. They are often disorganized and they do what feels good in the moment, and they often give it all they have because they are less considerate of consequences. In rehab, they may be more forgetful of techniques, so they must be monitored and reminded that quality reps are preferred over quantity reps. Neuroticism refers to the tendency to experience negative feelings. Those who score high in this are easily upset, emotional, frustrated, and often have high levels of stress, anxiety, and depression. These qualities are directly related to health, and for athletes with high neuroticism, clinicians should help alleviate stress by motivational practices such as positive self talk, along with insisting problem focused coping behaviors rather than their current avoidance coping strategies. Low levels are good and desired by clinicians. This is a good indicator that they will adhere to the rehab. These individuals are typically calm, composed, and they often don't react too intensely to perceived stressful situations. Lastly, openness to experience describes the cognitive style of people. High openness indicates creativity, imagination, and variety. Trainers with highly open patients must get creative with variation to exercise. They strive for new learning opportunities, so it is best to have them problem solve and try to figure out things for themselves. Low openness people prefer routine and simple terms. It would be best to stick to a solid plan that has little variation so they feel comfortable in successfully completing tasks. The average non-injured athlete in the US has high levels of extroversion and low levels of neuroticism, meaning they are sociable, motivated, hardworking, generally happy, and they hardly experience anxiety and stress, and they have healthy coping pathways. However, when individuals get injured, trainers rehabilitate them based on practices that are catered to the normative measures of high extroversion and low neuroticism, meaning they assume athletes to be well motivated and focused with suitable coping strategies. The problem with that is that personality types are not properly considered, therefore, the adherence to training methods won't be as effective if not catered to their personality type. Because personality plays a major role in both the biopsychosocial model and the cognitive appraisal model, because of its influence on the several components of these, such as the behaviors and emotional responses, it should be properly addressed. Therefore, athletic trainers, therapists, and even coaches can use this information to effectively communicate with their athletes in ways that they will best respond. Future research should focus on moderating the effects of personality and explore combined effects of personality dimensions and its influence on the rehab process. The potential issue of this recommendation is that the five personality model is too broad because these are independent of each other and aren't considered for combined traits, which are more direct and narrow, which could be better for addressing injury. I'd like to say thank you to Pacific University and the Kinesiology Department, and a very special thank you to Dr. Dolphin for the guidance and support throughout my time here and for always believing in me. I also appreciate the support from my friends and my family, and thank you for watching. Here is a list of my references.